7 million.
That's the amount of deaths every year from air pollution exposure.
2.1 billion.
That's the number of people primarily relying on polluting fuels and technology for cooking every year.
99%.
That's the percentage of this world's population living in places where air pollution exceeds the World Health Organization's basic limits.
Air pollution, defined as the contamination of the air by harmful substances, greatly affects both local and global health. Major sources of air pollution include industrial emissions, vehicle exhaust, the burning of fossil fuels, and agricultural activities. These pollutants not only degrade air quality, but also have severe health impacts. Many respiratory diseases are closely linked to poor air quality. Additionally, air pollution contributes to cardiovascular diseases, including heart attacks and strokes, and has other serious health effects, such as premature deaths, adverse pregnancy outcomes, and developmental issues in children.
But before we dive further into this critical issue, let us briefly introduce ourselves.
Hello, my name is Andrew Tomchuk, and I'm a rising junior at the Webb School of Knoxville in Knoxville, Tennessee. I'm a founder of a campaign aiming to raise $400,000 worth of medical equipment to hospitals in Ukraine, and I currently serve on the youth health board in my city. This year, I work closely with faculty to bring HOSA to my high school, and I currently serve as the president for the Interact Club.
Hi, my name is Pranika Kumar, and I'm also a rising junior at Edina High School in Minnesota. I'm currently involved in lab-based research on protein scaffolding and enzyme prodrug therapy against cancer cells, as well as plasma carbon capture technology at the University of Minnesota. I also serve as my school's HOSA president and serve on the Health and Human Rights Commissions for my city council.
So, from a global health perspective, air pollution is a significant concern that affects all countries, particularly urban areas. Vulnerable populations, including low-income communities, children, and the elderly, are disproportionately impacted. According to the World Health Organization, air pollution is responsible for approximately 4.2 million premature deaths annually. The economic and social impacts of air pollution are profound. Healthcare systems, particularly in resource-limited settings, face significant challenges due to the high cost of treating pollution-related illnesses. Countries like India and China experience some of the highest levels of air pollution globally, resulting in significant public health challenges. Similarly, urban areas in Latin America are experiencing rising pollution levels, leading to growing health impacts on their populations. Low-income communities and communities of color face higher pollution levels and have more pre-existing conditions like asthma. For example, Black Americans have one of the highest asthma rates. In America, red line neighborhoods, often near major pollution sources, experience higher rates of asthma and cancer. Across the world, the growth of e-commerce, especially during the COVID-19 pandemic, has also increased air pollution. More delivery trucks, warehouses, and container ships have led to higher ozone and particle pollution. For instance, the Amazon warehouse, Chicago's Gage Park, a predominantly Hispanic neighborhood, exposes residents to higher traffic-related pollution.
But despite the worsening outcomes, there are many potential and proposed solutions to air pollution and climate change. Our most comprehensive approach is a threefold strategy. First, distributing aid to already affected populations. Second, taking policy action at the government level to decrease future emissions. And finally, advancing carbon capture technology to reverse past emissions. Now, first, in terms of short-term relief aid, there are two main types, financial and material. Financial can include cash grants to those most affected by pollution-induced illnesses and climate change impacts. It can cover healthcare costs or improvements to make living conditions more bearable, such as subsidies for air purifiers and insulation in homes globally. And secondly, we can see material aid, which includes healthcare resources like distributing protective gear, like masks or air purifiers, and even installing mobile clinics in high pollution areas across the world. And the second part of our approach involves a policy-level action-based approach for emission reduction. I have actually drafted a sample legislative bill on the right side, which could be proposed at national levels across different countries. It includes two solutions that work in joint. First, a carbon tax, which taxes the biggest energy polluters and companies. And the second is a reduction of fossil fuel subsidies, which then cuts the subsidies that governments give to fuel these polluters and redirects those billions of dollars to renewable energy. This approach, which has been successfully implemented in countries like Canada and several EU nations, has reduced emissions by 10% on record, according to Brookings, and increased private sector investment. With this new investment and competition in the market allowing renewable energies to emerge, a Bloomberg estimate writes that energy prices could significantly decrease, even by 500 USD just by the next few years. Now, the final part of our solution is carbon capture, which involves capturing CO2 at emission sources, transporting it, and storing it underground. There are a few current carbon capture methods, but many of them are inefficient. First is direct air capture, which captures CO2 directly from the air, but is expensive and energy intensive. Second is pre-combustion capture, which removes CO2 before fossil fuels are burnt, but requires new infrastructure and high capital costs. Third is biological capture, which uses algae in plants to absorb CO2 through photosynthesis, but is resource intensive and slow. Given the limitations of these methods, I want to introduce research that I've been conducting at the University of Minnesota under Professor Siam. We're developing a plasma-based carbon capture technology in his plasma propulsion lab. And our novel method essentially involves pushing CO2 through a plasma-filled tube. The plasma, which is a superheated gas, breaks the bonds in CO2 molecules, causing them to dissociate. Then, when the plasma is turned off, the CO2 molecules do not fully reform, reducing CO2. The simpler elements, carbon and oxygen, are then separated and stored or utilized in other processes, preventing CO2 release. This method, using extremely high temperatures, offers higher efficiency, making it far cheaper and far more effective. In fact, this technology can help us achieve carbon capture faster, aligning with the global net goal of net zero emissions by 2050.
So, as you can see, the health impacts of air pollutions are so significant, causing widespread diseases for billions. So, what can you do today? Get involved by supporting organizations dedicated to environmental justice and pollution reduction. You can advocate for clean air policies at all government levels in your countries. And you can also spread awareness about the harmful effects of air pollution and the urgent need for action, because together we can make a difference and create a healthier, more equitable world. Thank you so much.
Thank you.